Hi everyone, welcome back to Essence Talks, a platform where we talk about social work and mental health. Today we'll be talking about 5 real challenges faced by social workers in Nigeria, things people don't talk about but absolutely should be talking about. So if you are in the field of social work or you're just curious about what we do, stick around because this is going to be an insightful video for you. Let's be honest, a lot of people don't know what social work is all about here in Nigeria, not to even talk of what they do. And many people think social workers are just volunteers that work with the NGO. A lot of people even think it's just like a fun career like that. And I could also imagine myself some 10 years back when I first got admission into the university that I was given social work. Like I had to go online to search for what social work is all about and what they do. The level of awareness was very, very low as of that time. And a lot of people forget the fact that social workers are trained professionals who handle series of cases such as family issues, domestic violence, mental health issues, and even intervene when there is crisis in the country, such as war, emergencies, or when there is an outbreak of epidemic and diseases. The second challenge we'll be talking about here is lack of funding and support, or inadequate funding and support. You see, many social workers here in Nigeria operate with no proper funding, and you can imagine a situation whereby you're trying to help a family come out of problem with nothing but your own personal money. Like, it's just something that you cannot write home about. And I could remember then when I was still doing one of my internship at the teaching hospital there, the medical social service units had to depend on some philanthropists outside the hospital setting to donate to the hospital so that they can be able to use all of these donations to help the client that have been referred to them by the doctors in the hospitals. And government also do not provide this basic logistics for the hospital, like no transport, no emergency support, and nothing. The third challenge we'll be talking about here is mental and emotional burnout. As rewarding as the profession of social work can be, it is also very noticeable that it can be very, very draining. Like, social workers are individuals that work with series of clients. They work with series of individuals, communities, group. You attend to case of trauma today, poverty tomorrow, cases of mental illness the next day, child abuse the following day. All of these takes a toll out of the social worker. And there is not much facility here in Nigeria that social worker can access to also solve out their own emotional or psychological needs. The fourth challenges we'll be talking about here is poor policy implementation. As we know that policies are made to better the life of every individuals in a country or every citizens of the country. And even though we have laws that protect the rights of the children, the women, and also the people with disabilities, all of these laws were not implemented, or some of them were not appropriately implemented. And you can imagine a situation whereby a social worker that is working in a rural community report a case of abuse to the police officer or to the community head, and such case was just brushed under the carpet. This is as a result of poor implementation of policies in the country, and it is also one of the serious challenges that is eating the social work profession here in Nigeria. The system is not really working in our favor, and as a result discourages social work interventions. The fifth challenge that social workers face here in Nigeria is public misconception. In fact, this is one of the top challenges that social workers face here. Public misconceptions. A lot of people think social workers are just like church volunteers, or many even think that they are just like random caregivers that just help people on the street. And a lot of people here in my own part of the world even think social workers are just like those that park the mentally disabled people, a lot of people think social workers are like that, whereas a lot also think that social workers are just like counselors or like different sort of names like that, whereas forgetting the fact that social workers are trained individuals who intervene to crisis and who ensure that people function well in their immediate environment, and also help to remove barriers that is blocking individual from achieving its full potential. So when you see a social worker in Nigeria, remember, we are holding a broken system with grit, with love, and with little support. So if this video opened your eyes a bit, like it, share it, and also subscribe to the channel. Let's raise awareness and make the work visible. So this is Essence, a platform that talks about social work and mental health here in Nigeria. Thank you, and remember to stay strong.